Hello, medical assistants, and welcome to Module 9. Earlier in the week, I did post a video about the what to do and not to do for medical emergencies and CPR training. So now I'm going to spend some time actually talking about different types of medical emergencies. So one of the first things that we need to understand is that in this chapter, we're focusing on a medical emergency. And as a medical assistant, you do have a responsibility in those situations. You will need to have training in these areas to make sure that you are prepared and know what to do if there is a medical emergency. First and foremost, though, anytime you do have a medical emergency, the first thing that you want to do is to inform the provider. Get a provider or a nurse practitioner, a physician's assistant, get anybody with that medical training on their way to you to help, especially if you have to do any sort of medications or anything like that. You need to have the provider order. You also may need to, depending on the severity, contact some other services. You may need to contact emergency medical responders. You may need to call in EMTs or emergency medical technicians, advanced medical technicians, or even paramedics. So you want to make sure that you can have that communication across all the boards with all of those individuals. Now, when we start talking about medical emergencies, we also need to discuss the topic of the Good Samaritan laws. Now, this isn't the first time that you've ever heard me speak of this or bring up this topic, but we are going to go a little bit more in depth than we have in the past. So the Good Samaritan laws were established to encourage healthcare professionals to volunteer in emergencies without the fear of financial liability. Now, this generally applies to situations that are both inside and outside of the medical office themselves. As a medical assistant, you have 3 legal responsibilities in any emergency. And with those, the first one is that you need to stay within your scope of practice. So making sure that you are accountable for yourself, for your employer, and the public as a whole. Remember what you are and are not allowed to do. Second thing that you have a legal responsibility to is to ensure that documentation is constant in an emergency. So what that really means is anytime that there is an emergency, you want to make sure that you at least have one person documenting. Anytime an order gets yelled out, anytime we have to move something, if there's a time that needs to be documented, there should be one person who's doing that consistently. And that's so when we actually all sit down at the end of it and sort of debrief about the emergency, we have that emergency readiness documentation. Along with that is you are also supposed to make sure that you are updating any emergency preparedness plans on a regular basis. Emergencies aren't all the same. And so you want to have sort of a basic plan in place of when an emergency happens, this person is responsible for A, this person's responsible for B, this person's responsible for C. So that way you have that sort of in place. And the last legal responsibility is to do all that you can to prevent emergencies in the future. Now, a medical emergency that comes into the clinic, sometimes we can't control, but we can control some that happen within an office on a regular basis. We can actually make sure that we sort of maybe stop those emergencies from happening or even prevent them with the plans that we do have in place. Now, there are some guidelines for providing emergency care. As a medical assistant, you must stay up to date on emergency plans of your office or the facility and the community around you. I mean, even take into consideration the pandemic. How did we handle that emergency? You may also need to handle emergencies that come in within 3 main types of situations. The first type is over the phone. So this is probably going to be the most common of the 3 that you'll come in contact with, But this is where your triage skills that we talked about in Module 8 will really come into play. Because remember, triaging means that you are assessing and prioritizing the emergency care that is needed by patients. The second type of emergency is one that's going to happen near the medical office. So whether that be, for example, a couple years ago, we had a situation where the bank across the street from the school had been held hostage. Now, that wasn't a situation that was actually happening in our building, but it was still near our office, so we still put emergency plans in place. It's the same kind of thing that happens in a medical office. It may not be happening necessarily in your office, but near your office, and you have to be ready for whatever might come into play. And finally, the last one is something that happens inside of the office setting itself. Now, the picture on here from Grey's Anatomy, this one down here in the bottom, while this isn't something that happens all the time, but there are situations where a person may come into a hospital or clinical setting and they may have a weapon of some sort, whether that be a gun, whether that be a knife, whether that be, I don't know, anything that's going to cause a problem in the future, or it could harm somebody. This is where we have to be prepared. And in these situations, the best thing that you can do is just sort of remain calm. The more freaked out you get, the more amped you get, all that's going to do is add on to what that person's already feeling. So those are some of the ways that we could have to handle emergencies near or in the office. Now, one of the things that we have at every provider's office is going to be a crash cart. Now, this crash cart is available for emergency situations, and we have them readily available because it does contain all of these supplies that may be needed during an emergency. And it should be accessible to anyone within that medical office. The crash carts should be close to where an emergency may happen, but it also will have a emergency medical box or drug box. So we don't want to just leave these out into an open area because anybody could get into that box. So they do need to be sort of kept away out of the line of sight of people, but close enough that we don't have to go and scavenger for it. Now, some of the drugs that you may see in a medical drug box or crash cart box are things like activated charcoal. That's going to help a patient to vomit or induce vomiting if they've overdosed or if they've taken something that they shouldn't have. Benadryl would be used if we had an allergic reaction, and if the allergic reaction is severe enough, they would have things like epinephrine on it. We may also have insulin on the crash cart because if we have a patient who is going into hyperglycemia, so their glucose levels are super, super high, we want to bring that back down. We may have to give them some insulin. If the person is injured and they have an open laceration, we may have lidocaine on there to numb the area so we can start cleaning that up. Nitroglycerin would be on there for sure. If a patient comes in complaining of chest pains, we would want to make sure that we have that readily available. And always on a crash cart is normal saline, and that is used to sort of irrigate or clean up any wounds or injuries. So now let's kind of get into what I'm going to call some of the fun stuff and discuss some actual medical emergencies that you might encounter. Now, this week, like I talked about, you will be going to the Heart Solutions Testing Center and properly teaching on CPR, but you're also going to look at first aid. I'm not going to discuss those two things really in this video, but I do want to talk about some of the other things that you may come in contact with. And one of the first things that you may come in contact with is respiratory distress. Now, this could be due to some long-term disease such as COPD, or the other name for that is chronic obstructive pulmonary disorder. It could be due to asthma, allergies, anything like that. It could also be due to an emergency situation, something such as anaphylactic shock or anaphylactic response to a medication or a vaccine or a bee sting. any of those can cause respiratory distress. As the medical assistant, you need to be able to recognize the signs and symptoms of respiratory distress, and some of those could be things like acute anxiety with little gasping breaths. The patient could be turning cyanotic, which means that they would be turning blue, and you would notice that in around their lips, the tips of their nose, fingertips, and if it's summertime, their toes. They could have nasal flaring or very noisy breathing, but they could also have tachypnea, which is like rapid breathing. That means that they have more than 24 breaths per minute. Now, one of the ways that we can help to treat respiratory distress is to administer oxygen to our patients. And for the most part, a provider is going to tell you to start that at about 2 liters, but always get their approval before you do so. Chest pain is another medical emergency we can encounter. Heart attacks are the leading cause of death in both men and women in the United States. So it is really important that we know the signs and symptoms and are able to help and jump in if we do see those signs and symptoms. One of the first signs that you'll see is the patient will be complaining of pain in the middle or left side of the chest, and they may describe it as sharp, stabbing, crushing, squeezing, or even aching. The pain may radiate to the left arm, which then may go to the back or up the neck. This is very common in most cases, but there are some cases where the pain could be on the left side, or the right side. So please make sure that you're asking all of those questions as necessary. Now, like we talked about last week when we talked about triaging, if a patient calls into the office and they're complaining of chest pain and they're alone, the first thing that we want to do is keep the patient on the line. If they're home alone and they cannot seek medical attention, have your coworker call 911 for the patient themselves. You stay on the line until the EMS system arrives. You want to write down their name, their location, and if they go unresponsive on the phone call, the time that happened. So when EMS gets there, they know how long that patient's been down. The last one on this slide is talking about shock. Now, shock is the collapse of your cardiovascular system, and it's caused by an insufficient cardiac output. If a patient goes into shock, they could have weakness, they could become very clammy or cool, they can get confused, unresponsive, or even nauseous. And shock doesn't just happen because their cardiovascular system collapses. They could hear bad news and just that sort of happens. But in any situation where a patient has gone into shock, the first thing that we want to do is make sure that they're safe, right? Make sure that the area is cleaned up. They're not going to hurt themselves when they come out of it. And if you have a aluminum blanket, those are the best to just sort of get them that heat back to their body and sort of bring them back. So those are the first couple that I want to talk about. I want to talk about some first aid emergencies because I feel like while we discuss these in sort of those interactive activities we give you through Heart Solutions, we don't really go too far into them. So first aid is really the assistance that's given to any person suffering a sudden illness or injury, with the care provided to preserve their life, prevent the condition from worsening, or even promote recovery. Now, some situations you may offer first aid to are patients who are bleeding, have open wounds, they have soft tissue injuries, or even burns. So let's look at each of those a little bit more and look at some beautiful pictures. So the first one that we have is bleeding. Now, bleeding can either be external or internal. So because bleeding is both external and internal, we need to look at these a little bit differently. External bleeding is bleeding that occurs when the skin is broken. This type of bleeding we actually can control. So when you have an injured person who has external bleeding, we want to put a bandage around the injured part and maintain pressure to that site. If the blood seeps through the dressing, do not remove the first bandage, because what has happened is the the bandage itself is starting to make adhesions to the wound. And if you were to remove that, it would rip those adhesions, and now they're bleeding all over again. So you just add more on top. Do not remove the first. Internal bleeding is the one that's actually more dangerous, and it's harder to determine because we can't see it with our naked eyes. When we have internal bleeding occurring, that means that there is damage to the tissues and the underlying organs. The only way to diagnose this is with medical experts in an office. Maybe that's getting x-rays or CT scans. We can't just determine that they're okay just by looking at them. The next thing we have are open wounds. These are seldom life-threatening unless they penetrate the head, chest, throat, or abdomen. If any of those do occur, you want to contact EMS right away. Take them straight to an emergency room if you're able to drive, but if it's you yourself, call an ambulance. As a medical assistant, one thing that you can do is always try to control the bleeding. So most of the time, if the injury is not life-threatening, it will require irrigation, debridement, possible sutures, and antibiotics. For open wounds, there are some wound care pointers to follow. First, when you apply a dressing, make sure that the dressing is sterile and place it directly over a wound to absorb any blood or other bodily fluids. Apply a bandage, which is a strip of binding material to hold the dressing in place. You can use things like rolling gauze, elastic bandages, or ACE wraps, or even Coban. But what you don't want to do is try to, get in there and clean it right away. You want to stop the bleeding first, and then you can clean. Soft tissue injuries are next. This is a trauma that involves both the skin and underlying tissues. The best thing that you can do for soft tissue injuries is elevate the body part above the heart. In doing so, what that's going to do is help to reduce any swelling that may occur, and swelling actually can make things worse. If you can, and if the patient can tolerate it, put a cold pack on the body part. Sometimes it's best to do a cold pack with water. So first of all, it makes it a little bit easier to maneuver the cold pack, but it also keeps the cold pack colder longer. Sometimes we would also say put something between the cold pack and the body part. So a t-shirt, a towel, something to that effect. For more severe injuries, make sure that you do immobilize the body part so that way we don't have the injury keep re-injuring itself. And lastly, we have burns. This type of injury occurs when an area of tissue is destroyed by the action of physical heat, chemical activity, high electrical current, or even heavy exposure to radiation. The severity of the burn depends on the amount and the depth of the tissue that is injured. When treating burns, it's really important that we use cool water to soothe the area if there are no broken blisters. If there are broken blisters, we do not want to add any sort of cool water or anything like that to the salve, nothing like that to the system. Burns should be dressed with a dry, sterile dressing, and pain can be managed with over-the-counter, pain medicine, or sometimes we even inject a pain medicine, but only when it's ordered by a provider. All right, guys, that is what I have for Module 9. If you have any questions, please make sure that you bring them to class, and you should be looking forward to an email from me on how class is going to run on Thursday. So have a great week and watch your emails. Bye, everybody.